with me, I am so pleased to bring people from my alma mater. I graduated from the Albany College of Pharmacy a few years back. Won't say when. But anyway, Kimberly Skylstad is an instructor at the Albany College of Pharmacy. And you're in the professional practice program?
Pharmacy practice program.
Pharmacy practice. And I have a student, and I love to have students on this show. No kidding. Michelle, and I want to get your last name.
Fioravanti.
Fioravanti.
Yes.
And we're going to be talking about, you belong to the, they call it the American Association of...
It's the American Pharmacists Association Academy of Student Pharmacists.
Right. They changed the name since
yeah.
a long time ago. And tell me what you do, because it's so important to get involved as a student in the career that path that you're going into.
Well, absolutely. So the short name for it is APHA. So with APHA, we're really all about promoting the profession of pharmacy and also getting out into the community and providing direct patient care. And one of the things we've been doing recently is, in conjunction with other students from the college, is advocating for the profession of pharmacy. Going to legislators and just making sure that legislation is keeping up with the ever-evolving profession.
Well, the Practice Act has changed. Mm-hmm. In my lifetime, it has changed considerably. Now you give injections, vaccines.
Yep.
You can counsel your patients. All those are relatively new. I mean, not new, but new enough the past 20 years.
Relatively, yes. Mm-hmm.
Absolutely.
So we're taking pharmacy really to the next level. We're no longer just counseling, but we're doing practice management and really looking at the whole patient and how we can be involved in making their healthcare outcomes better.
And some are becoming diabetic educators.
Absolutely.
And there's so
asthma
many
educators. Absolutely.
What interests you in pharmacy? What practice? What part of the practice?
For me personally, oh man, there's just so much out there that I really am not sure yet. I've kind of been actually looking into, personally, nuclear pharmacy, about radiopharmaceuticals. So,
that's really
I mean, there's so much you can do. Yeah.
Play with those baby cyclotrons, it'll be fun.
Yeah.
What I'd like to hear from you, Michelle, was that you're not sure, because it means that you're open to looking at all the practice of pharmacy. Pharmacy is incredible. Now, a group has gone or will be going to Washington, D.C. What is that now?
Yeah, so in July, we'll be having 3 students from the college go down to Washington, D.C. and making appointments with legislators on the national level to just, one of the big issues we'll be talking about is the provider status. So currently, pharmacists are not recognized as providers. So we just really want to push that agenda and make sure that they are, because they have so much clinical knowledge, so much to offer. And
incredible the knowledge that's there, and it's not recognized quite as much as it should be. Mm-hmm. One of the things that I just read in the paper is that our general practitioners, there's going to be less general practitioners because everybody wants to go to specialties. That means that nurse practitioners, pharmacists, all of the pharmacy, or all of the practice, medical practice below medical doctor is going to have to take on more tasks.
Exactly, and if patients can have access to a pharmacist's expertise, it's really going to result in better outcomes and lower costs. Absolutely.
And I would recommend that when you go to a pharmacy and you get your prescription filled, just don't take, please sign here. Ask to speak to the pharmacist. It's very important that you talk to your pharmacist, because there may be questions that you have but you're afraid to ask. Don't be afraid to ask, because most pharmacists love to counsel.
Oh yeah, I love to just come out, in front of the counter and talk to you. Absolutely.
Yeah, because you want to be able to talk to them. Not only that, because when you start talking, you share information.
Absolutely. And we really encourage patients to find a pharmacist they love.
Yeah.
You shop around for your doctor till you find one you're comfortable with. You should do the same with your pharmacist.
Exactly.
One that will take time and listen to you, get to know your prescriptions. And we really promote trying to use one pharmacy so that the pharmacist can do a thorough job in checking all of your prescriptions. So it's very important that you find one that you're comfortable with.
And I like what you said about going to just one pharmacy, because then if you go to your dentist and then you go to your podiatrist and then you go to your medical doctor and you get a script from each one, you need to know. And the one person that is handling your meds should be your local pharmacist.
Absolutely. The pharmacist is geared to do that and can take all that information and compare your different prescriptions and make sure that they're safe for you.
And I used to find that sometimes they'd go to two different, like a specialist, and then they'd go to their general practitioner, and then they'd have like the same meds prescribed. It's like, wait a minute, you can't take these two because they're the same.
Yeah.
Because they don't, unless you have someone kind of coordinating.
And that happens a lot when people are discharged from the hospital.
Exactly.
Things are changed in the hospital, they're written new prescriptions. When they get out, they don't necessarily know what's new, what's old, and duplication occurs quite often. So that's another role for the pharmacist.
And we do know that a lot of hospital admissions are due to medications.
Absolutely.
Not so much errors,
No.
but medications mismanagement or side effects. So you're going into a wonderful profession.
Yeah, I'm excited.
Yeah, what year are you in?
I'm going into my third professional year.
Professional year.
It's a 4-year professional degree.
Yeah.
Almost there.
It's a 7-year course, just so everybody knows. It's 7 years.
6 years at Albany.
Yeah, 6. Okay, 6. Well,
But many of our students,
Go on.
up to 80% come in with 3 years under their belt before they get into our professional program.
Yeah,
And
that's
many,
why I remember that we had a lot that they were
Absolutely.
going 7 years.
And many go on for residencies after they graduate.
And you might go into nuclear medicine or oncology.
Absolutely.
And so there's whatever field you go into. And of course, the other one is compounding. That's becoming a big field.
Very big.
And that's my favorite. I love compounding. So it was one of the areas that I think did very well in. So it was fun to do.